participate in with the conference, and I'm especially excited about today's session because we have invited some of our past authors from China to give a talk about their review. So for my presentation today, I'd like to discuss some of the highlights from our journal that were published in the previous year. Firstly, I'd like to show you a list of the most highly cited articles that were published from 2022 until now. And later on, I will discuss some selected reviews that I believe are really important and practice-changing that were published in the past year. So this is a list of the most cited articles that were published from 2022 until now. The most cited paper so far is a consensus statement article that was published, put together by the COVID-19 Thrombosis Markers Colloquium, and on the current and novel biomarkers of thrombotic risk in COVID-19. So I'm sure there's no need for me to say that, all research related to COVID-19 is still extremely important, extremely topical, and very highly accessed. I'm also very pleased to see that our review on the molecular and metabolic landscape of iron and ferroptosis has been very well accessed, very highly cited so far. And we'll be hearing from Professor Fudi Wang later on today. The remainder of reviews on this list consists of reviews both in the clinical and mechanistic fields, including atherosclerosis-related reviews that are always very, well cited, very highly accessed, including reviews on therapeutic strategies and imaging modalities. Next, I'd like to go into a bit more detail on some of the reviews that we published in the past year that I'd like to highlight. These first few reviews are all on risk factors for cardiovascular disease. So I think these reviews are incredibly important because the identification of the causes and the risk factors underlying the disease, and these include behavioral, physiological, environmental, and genetic risk factors, can result in the development of some prevention programs as well as new therapeutic interventions. We've also, at the start of this year, published a review on hypertension in China. So I'm sure you're all aware that hypertension is one of the major risk factors for stroke and coronary heart disease in the Chinese population. So Professor Jiguang Wang will be discussing this review later on in this session. The first review on risk factors I'd like to highlight is one by Thomas Munzel and colleagues. So in this paper, the authors very aptly use the phrase, genetics load the gun, but environment pulls the trigger. And they use this phrase to explain that although genetic factors no doubt predisposes an individual to disease, we can't discount the large contribution of environmental stresses to disease burden. These authors also describe the concept of the exposome, and this can be defined as the measure of all the exposures that an individual experiences during their lifetime and how they relate to health. In this paper, the authors focus especially on environmental, physical, and chemical exposures, and these include air, light, and noise pollution, and as well as climate change. And they discuss how these factors can directly cause cardiovascular disease by increasing inflammation and the production of reactive oxygen species. But they can also indirectly trigger adverse cardiovascular changes by impairing mental health. This next review is by Nathan Wong and Naveed Sattar, and it's focused on cardiovascular risk in patients with diabetes. So the cardiovascular risk factors that are relevant for this particular patient population include those that are very well known, such as obesity, dyslipidemia, and hypertension, and as well as lifestyle factors such as an unhealthy diet, increased alcohol consumption, and smoking. However, there's also the role of a less well-known risk factor. Ectopic fat is also discussed in this review. You can see in this figure here that an increasing waist circumference or an expanding waist circumference can increase ectopic fat deposits in major organs, including the pancreas, the liver, and the heart. And this excess fat accumulates well before overt type 2 diabetes develops in most individuals. Similarly, in this next review, the authors, Lucia and colleagues, also discuss the role of the obesity in the development of cardiometabolic disorders. So this figure taken from the review outlines the main mechanisms that are involved in the development of obesity and how they can elevate cardiometabolic risk. So for example, subcutaneous adipose tissue can expand via cellular hypertrophy in individuals who are lean and healthy. However, in individuals with obesity, this expansion is limited, and this can result in an increase in lipid accumulation in visceral adipose tissue. The review also discusses the concept of fatness but fitness, the paradox. And this describes how, although high physical activity levels can attenuate, at least partly, the adverse effects of obesity on cardiometabolic health, it still seems that those with obesity are still at a higher risk than their peers with normal weight. Finally, we also, at the start of the year, published a review that discussed both the modifiable and non-modifiable risk factors present in patients with atrial fibrillation. So the development of atrial fibrillation is very complex and often involves many years of exposure to multiple risk factors, and these all contribute to AF initiation, persistence, progression, and recurrence. And therefore, as a result, numerous comprehensive risk factor management strategies have been proposed, which were discussed in this review. The next few reviews that I will highlight all describe novel targets for cardiovascular therapies. So in the past decade, researchers have identified numerous drug targets from animal studies. However, only very few agents are tested clinically, and even fewer become approved. So given that cardiovascular disease still remains the leading causes of morbidity and mortality, more effective and safe drug targets are needed for the treatment of cardiovascular disease. The development of novel drugs should really be based on an improved understanding, a better understanding of some of the mechanisms that are implicated in disease from robust preclinical data, as well as from well-designed clinical trials. In this review by Julia Brands and Kaushik Ray, the authors describe some novel and upcoming lipid-lowering strategies to prevent cardiovascular disease. So these strategies can complement or work synergistically with existing therapies. Advances in drug development, including the introduction or the use of monoclonal antibodies, siRNAs, and antisense oligonucleotides, have improved target organ specificity and increased the duration of action of therapies. So in this review, the authors describe novel drugs that target PCSK9, apolipoprotein C, angiopoietin-like 3, CETP, Lp(a), and HDL cholesterol to modify lipid levels and reduce cardiovascular risk. In this next review, Gawaz and authors describe novel therapeutic targets and compounds for antiplatelet therapies that are currently in preclinical development, some of which have a more favorable safety profile than currently approved drugs with regard to bleeding risk. This figure here shows all the surface receptors on platelets that can be targeted by drugs to either activate or inhibit platelet function. So targeting these novel intracellular molecules might improve the efficacy and safety of antiplatelet therapy by supporting the microcirculation and supporting functional recovery after myocardial ischemia. So finally, the last review I'd like to highlight is one by Backhead and colleagues. So in addition to providing an overview of the evidence on the link between the gut microbiota and cardiovascular disease, they also discuss some novel cardiovascular therapies targeting the microbiome. This includes the use of probiotics, symbiotics, and postbiotics, as well as bioengineered bacteria and bacteriophage therapy. So in addition to these reviews, I'd also like to mention that we also publish short format articles, and these include news and views articles that Greg mentioned before in his talk. So news and views articles are based on recent publications and are invited, and we invite authors to discuss some of the key issues that arise from original papers. So in the past year, we've published news and views on 2 articles that have implications for clinical practice for physicians. So this one on the left is about the importance of mental well-being in physicians, who've experienced adverse professional life experiences. And the one on the right is about the need for physicians to gain new skills in newer digital technology, such as AI-powered platforms. And finally, I wanted to emphasize that this year we published a series that's focused on cardiometabolism. So I recognized that we were publishing a lot of metabolism-related papers, so some of which I just described to you now. So we really wanted to bring them together in a series and to really emphasize the importance of the field, that this is an extremely topical area of research. So that comes to the end of my talk. So please feel free to contact the journal if you have any ideas for us, if you have any questions. Please follow and subscribe to our social media channels to keep up to date with our content. And thank you once again for your attention.